from Group 4, and we are going to tell you the findings we have about the whole vaccination in Myanmar, which has obstacles and still need to improve. So without further ado, let's jump to the presentation. Next slide, please.
So first of all, we will be talking about the recent situation of the pandemic in Myanmar. As of 25 September 2021, there are a total of 456,620 confirmed cases in Myanmar and a total of 17,465 cumulative deaths. And then there is about 3,471,251 people who have been vaccinated, fully vaccinated in Myanmar from a population of around 53 million as of September 2021. And the recent trajectory of the case is on a downward trajectory after a new wave of COVID cases back in July 2021. That resulted in a national lockdown. However, it is also must be important to remember that it's hard to confirm the true number as the country was still in chaos following the coup back in February, with protests and rioting every now and then, rebel forces fighting the government, and the government fighting them all. Next slide. So how the government is taking measures? The COVID-19 illustrated the need for a robust unemployment insurance scheme to provide better support for laid-off workers. Although there is a provision under the Myanmar Social Security Law for an employment insurance scheme, it has not been established for the work. It is on the workers laid off in the government sector. Next slide.
Okay, thank you, Radhi. So perhaps I will explain to you about the vaccination progress that has been going on in Myanmar. So actually, before the coup happened back in the 1st of February 2021, the first dose of the vaccine has been administered in the Yangon General Hospital back in 27 January 2021. But then the coup happened and the situation became uncertain and pretty chaotic. So the vaccination progress was hindered at the first months. But then as per 28th of September 2021, roughly about 9 million doses has been administered. And it is estimated that 8.3 of the population have been vaccinated. It is according to Reuters, but it is worth to be mentioned that since some vaccine require like at least 2 doses to be administered to one individual, maybe the estimated population that has been vaccinated remains uncertain because maybe the number might be lower because you need to double administer the vaccine. And actually, before the coup happened back in 1st of February, the goal is to vaccinate at least 40% of the population. But since the situation becomes uncertain, it is has yet to be clarified and to be addressed, which what is the current goal as per now. I think that's all from me. My friends Mo and Azra will tell you guys about the obstacles that is bound to happen during the hard time. Next slide, please.
Okay, so during the vaccination progress, there are some obstacles that occur. And the first one is because of the military conflict or coup d'etat in Myanmar. And this incident sparked a wave of protest from the citizens of Myanmar. And among the residents who staged the demonstration, there were thousands of health workers, and it caused the healthcare system and vaccination program in Myanmar to be chaotic. And the second one is because of lack of trust. And this has happened because since the coup, the majority of the public has joined against China, since China is showing support for the military council, and this leads to distrust of the Chinese vaccine or Sinovac.
And also for the third reason, it is location and weather. As a vaccination should be stored in certain temperature and place, there are only few places to store the vaccine systematically. Myanmar weather is hot and dry, therefore it's not easy to keep the vaccines in such temperature. Next slide, please. So for the fourth reason is transportation. In Myanmar, some regions say don't have proper routes, especially western part and northern part of Myanmar. As there are some difficulties, the vaccines can be transported easily, and the citizens from that region have low chance to be vaccinated. And the final one is insufficient health workers. Obviously, the amount of citizens is more than the health workers. As the vaccination program is crucial, it needs a lot of professional doctors and volunteers. And also, most of the health workers are arrested by the military in the coup. There is no qualified health workers to volunteer in vaccination program. So that's all for now. For the next slide, Marco and Reginald present.
Okay, so next is we're going to discuss about what kind of vaccines that is currently available in Myanmar. Myanmar currently provide two kind of vaccines. The first vaccine is Sinopharm. Sinopharm is coronavirus vaccine made in China and has been tested in several other countries. And the next one is Covishield. Covishield is a corona vaccine that is made in India. Next is we're going to discuss about why there's only two vaccines, and we'll discuss by Marco.
Excellent. Okay, so we're gonna talk about why there are two vaccines in Myanmar. So the reason China gave Myanmar the vaccine was to prevent the spread of COVID-19 from the Myanmar-China border. By being given a vaccine, the hope is that the border between China and Myanmar can be safer from COVID-19. And the reason India gave the vaccine to Myanmar is social assistance in order to reduce the spread of COVID-19 in Myanmar. Now, Kinanti and Riandra will talk about why there are only two types of vaccine and there are no other types of vaccine in Myanmar.
So the following are the reasons why there are only two types of vaccine in Myanmar. The first reason would be the major caveat in the attachments of military coup domination of the once prominent military in 1962 to 2010, due to fear of losing their power to NLD. To be exact, the defense portfolios and army-run conglomerates. And the second reason would be the healthcare institutions that got seized from having antithesis member of the post-coup resistance movement. Next slide, please.
Okay, so the next slide is the third reasons. It is junta's military's public health responses were a sheer justification towards the military ongoing grip of the country. Not to mention the ludicrous price escalation in medical needs. The fourth reason is the only vaccine donations and health support that can pass some parts of Myanmar are China, Thailand, and India, which explains why China and India attained the privilege. And the last reason, but not least, the military's official claim of transition following an Aldi's approach vaccination drive was falsified. Okay, I will continue to the next slide.
Okay, where to go if you want to get vaccinated in Myanmar? The ward in charge of the township and other officials come and get names to be vaccinated. The government only provides vaccine for the older people age 60 above, and for the age below 60 must register through private sector. The government will provide the place for
vaccination in hospitals, schools, field, park, or hall. That must be wide area. Raisa?
For private vaccination program, which is held by the private hospital or company, those private hospital and company need to register and follow the requirement and process. The digital app can only be used for checking the certificate, and in Myanmar, most of the people doesn't want to be vaccinated because the country situation is unstable. But for those who are under 60 years old and want to get vaccinated, they have to register or call private hospitals. Okay, next slide, please.
Okay, lastly, I will be talking about the vaccine passport in Myanmar. In Myanmar, every people that has been vaccinated will get the vaccination passport in a form of a card. To travel between cities, one is obligated to bring the vaccination card. If the card is in one's possession, one will not be subjected by the quarantine process. Last, people are not required to bring the vaccination card to visit public places such as shopping centers or malls. However, some restaurants require people to bring their vaccination card. Next slide, please.
Okay, I think that's all from our group. We hope that you find our presentation insightful, and thank you. Have a good day.